بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. السلام الله عليكم ورحمته وبركاته. It's a great pleasure to be with you online today. I would have liked to be with you in person, but circumstances beyond my control stopped me from being there. But inshallah, I will endeavor and try to be with you on another occasion. I want to talk to you about spiritual care from an Islamic perspective. This is part of the great Islamic worldview vision that we are comprehensive, shumuliyah. We take care of whatever we take care of in a comprehensive way. So when there is a disease, we treat it physically with the drugs and surgery, but also we use spiritual means like dua and ruqyah to take care of that. Also, we take care of the spiritual needs of the patient. So this is part of the comprehensiveness or what we call shumuliyah of Islam. Now, we want to link the religious and spiritual principles to medical practice, and religious and cultural practices of spiritual healing are recognized. We do not dismiss them. And there are always clinical opportunities for applying spirituality, either through dua, through ruqya, or through talking to the spirituality of the patient so that he can feel better. And maybe that has got a physical connection because the hormonal structure will respond to the brain, and then it will do better in terms of immune protection. So we'll talk about how to use the concept of spiritual support in clinical practice. To start with, let us get clear the role of the concept of qadar. Qadar means Allah's predestination. Allah determines everything. He knows everything, what will happen and how it will happen. So human illness is part of Allah's qadar. So when somebody falls sick, that's the qadar of Allah. That's what Allah wanted. But some people do not understand this. They say that when we do medical treatment, we are trying to reverse qadar. Oh, it is a denial of qadar. No, it's not true. Both the disease and the treatment are part of Allah's all-embracing qadar. But we as humans, because we do not know everything, our knowledge is limited. We do not know which disease will be cured, which will not be cured. So our experience tells us that we have to treat all diseases. It is the qadar of Allah whether we succeed or do not succeed. And as you can know, there are some diseases like tuberculosis, which 50 or 60 years ago was feared as much as we fear cancer today. But tuberculosis today is a disease that is easily curable. So it's logical that we humans, in ignorance of the true situation, we play safe by treating all diseases to the best of our ability. But we know that our medical intervention is just an attempt, and we leave the results to Allah subhanahu wa ta'ala. In the same way, immunization and preventive measures are treatments before disease occurs. Therefore, they are not denial of qadar. So Allah alone determines the life and death of cells and tissues and organs. No human can give life or take it away. But humans, we are engaged as agents, but not as causes. Allah may bring his cure through our human intervention. And this is an argument that the Quran presents very well, because King Nimrod of ancient Mesopotamia, who was facing Sayyidina Ibrahim alayhi salam, could not grasp this in his arguments, because Ibrahim told the king that Allah gave and took away life. The king counted by killing one person and sparing the life of the other. So the king either did not understand or choose to ignore the issue at stake, because Ibrahim was talking about creating life de novo and not just saving someone from dying. So only Allah can give life and only Allah can take away life. So what is life? From a Tawhidi-based holistic understanding, Shumuliyat al-Islam, life is a complex biological, chemical, and social, and psychological, spiritual phenomenon. Now, the relationship among these various components of life are governed by the Sunanullah, the laws of Allah, Sunan al-Kawn. There is balance, equilibrium. In fact, disease is considered a state of disequilibrium when there is no balance or mizan. Or tadafa, like inflammation, is action-reaction against invasion of tissues by bacteria. Now, life that we have is the same as the life that other living things have. We share this biological life with plants and animals. But our spiritual part, only angels have got the spiritual component. Other living things on earth have got biological life like we do, but they don't have the spiritual life. They don't have the ruh. We are the only ones who have got both a biological life and a spiritual life at the same time. So when human life has no spirituality, it's like the life of an animal or a plant. It's very important for the doctor or nurse to understand that as you treat a human being, you are both dealing with the biological and spiritual aspects of life at the same time. Now, health means is a state of well-being holistically. It doesn't mean that you don't have disease. It means that you are holistic state of well-being. And health also, like life, has got spiritual, physical, and psychological and emotional aspects. So the spiritual component of health is the most important, because once the spiritual component is impaired or adversely, all other components are affected. Like if we die spiritually, then we run into a lot of other problems in our biological and social aspects of life. So whenever we talk about measures of quality of life in a holistic way, we must always think about the spiritual and other dimensions that I have mentioned. The other component I want to talk about is that of the ruh. The ruh is permanent, and the ruh is the essence of every person, because the ruh of each one of us was created before Adam was created, and it was put into Adam, and from Adam it passed on to all of us. But our knowledge of ruh is limited. We only hear things from the wahy, from the Quran. And we cannot go into details about that. But what we know is that in the third month of pregnancy, there is nafakh ruh. The ruh is put into the fetus, and from then on, the fetus becomes a full human being. Naza' ruh, which occurs at the end of life, is when the ruh is taken out of the body and the person immediately dies. Now, the Quran uses several terms to refer to ruh, like ruh, nafs, aql, nasiya, lub, al-dhihin, al-fuad, etc. The differences among them are known only by the experts, but we, the common people, these words all refer to the same essence of a human being, which makes us a human. Now, we move to spiritual support, because spiritual support is related to supporting the ruh or spiritual component of the person. Patients should be supported to spiritually to deal with the fear and anxiety of death, because if they can accept death as qadar, as inevitable, then they can be calm. Because why be excited about something you cannot change? Sometimes also, from a spiritual perspective, the doctors could make patients understand that actually death may be a good thing, because death is a transition. It's not an end. You come from the inferior temporal life on earth, hayat dunya, you will enter hayat al-barzakh, the intermediary life, to the superior and eternal life in the hereafter, hayat al-akhirah. So death opens the door to hayat al-akhirah, which is a better life than the life we are on this earth. Death is not a terminal event. So it's very important to understand that death is not a terminal event. Now, the link that persists in the human being after parents and children and properties and friends and enemies disappear is the link with Allah subhanahu wa ta'ala. And this link continues after death. So if we approach patients with this understanding of spirituality, inshallah, we can give them enough spiritual support to face the prospect of death and also to face the pain of the last days. We need to help them to ascend spiritually. As you know, the nafs, our spirit, has got various levels. But through psychological support, we can raise the level of the nafs. You know, the lowest level is called a nafs al-ammara. A nafs al-ammara is the evil inclined soul. It pushes you to do evil. But with more support, you can go to a nafs al-lawama. A nafs al-lawama is the level of nafs that has got conscious. It asks questions. Is this right or not? Which is higher than Amara. But the highest one is a nafsul mutma'inna, when you reach spiritual calmness. And once you're in spiritual calmness, nafsul mutma'inna is radiya, you appreciate, and marudiyya, you are appreciated by Allah subhanahu wa ta'ala, and qanu'ah, you are satisfied. So what we want to do is to give the patient enough psychological support to raise his nafs to the highest level. Once the patient is in the highest level of nafs al-mutma'inna, he can face suffering and pain of terminal illness, and also he can face the prospect of death in a very brief way. Now, we also need to give support to the patient cognitively. We need to let the patient understand illness as just one phenomenon, one stage in the big space of changes. So we need to let him understand that illness has got beneficial things. Illness and death are not necessarily bad, because illness can be a reason for forgiveness. It can also be a reason for bring out the best in human beings, because a person who can stay calm despite pain and suffering and stays composed comes out as a very noble, a very strong person. So to reach this level of understanding requires that we, doctors and nurses, understand the spiritual component of care. Patients also require emotional support, because sometimes illness and suffering make them doubt their self-worth and self-esteem and self-confidence. So we need to enhance their self-confidence and their self-worth. And the patient should understand the spirit of human creation, because humans, we are higher than any other creation that Allah created. That is why we are made Khalifa. We have got some control, but not all control, and we use this to build our civilization. So all of these positive things can be used to make the patient feel good. Now, Emotional support is very important for patients, and this is part of the holism that I talked about. Social support, we need to give them support socially so that he can live the remaining part of their life with the highest quality of social relations. We need to maintain their relations with their family and the wider community. And I think members of the family should be welcomed in the hospital as partners in patient care. We shouldn't look at them as people causing trouble in the hospital. No, they are part of the therapeutic equation. They are part of the treatment procedure because they help the patient get emotional and psychological support. And I think we need to try to make sure that the patient stays in contact with the outside world. His family and friends visit him. He gets news. He can participate in radio talks. So, whatever we can do to make the patient feel better, inshallah, we need to do it. Physical support, this is what we do best as doctors. We need to think of the needs of the patient, al-hajiyat, and we need to think of barurat, primary necessities. So our support shouldn't stop at primary necessities like basic staple food and water. No. Hajiyat, there are other things like emotional satisfaction. You give them food, not just food, but give them the favorite dishes that they like and an attractive way and attractive environment. Anything we can do to make the patient feel better, we need to do it. Now I come to spiritual healing. I've been talking about many things that work on the spiritual side of the patient and not the physical. But let us now look at the healing itself. Dua, ruqya and tawakkul and raja are spiritual treatments. We can make dua for the patient. And I would like that doctors and nurses learn how to make dua for their patients. They shouldn't wait for specialists or for ustad to come and make the dua. They themselves should know how to make dua. Ruqya is a treatment that can be used. And also tawakkul, if we can teach them about tawakkul ala Allah subhanahu wa ta'ala, that also is a spiritual approach. And we need to give them raja, hope. Once they have got hope, inshallah, all of these are spiritual attempts at improving their health. And we can do many things spiritually. For example, we can slaughter or we can give sadaqah to the poor on their behalf because then they get the ajr. And we need them to know that we are doing this. And healthcare workers, I want to emphasize, you must make dua for the patients because the qadr of Allah, once it is set, can only be changed by dua. As the Prophet said, لا يغير القدر إلا الدعاء. So dua is very important. And ruqya is very important. Healthcare workers should learn how to make ruqya because ruqya means reciting certain surahs or verses from the Quran, like the Mu'awwadatain. So this should be part of the training of the healthcare workers in an Islamic hospital. Now, we talk about the concept of Islamic chaplaincy. I want to make it very clear that chaplaincy is a special professional category to provide especially spiritual services to the patients. This doesn't mean that the doctors and nurses do not provide the things that I have talked about. They do, but because they are busy setting up drips, treating wounds, going to the theater, they may not have enough time to provide services that a full-time chaplain can provide. So a chaplain is not a replacement for the healthcare worker's role, but it is a complement. But now the issue of Islamic chaplaincy has got several issues that we need to discuss because chaplaincy is a service that serves people in spiritually vulnerable situations like fear of death, illness, or stress. Also, you have got chaplains in the army, prisons, and hospitals. I mean, a chaplain is there to support people in difficult situations. In the American and European practice, chaplaincy was assigned to priests because they consider it a religious vocation. Now, this practice would be repugnant to Islam because in Islam, we do not have a concept of priesthood. It means all of us can be chaplains, but some chaplains may have more training and also they may have more time to do this job on a full-time basis. So chaplaincy will play a significant role in a Sharia-compliant hospital. It's part of the holistic care that the patients get by fulfilling their spiritual and psychosocial needs. Now, who is a Muslim chaplain? I want to make it very clear that any Muslim with the knowledge and skills to perform religious duties, including spiritual support to the sick, is a chaplain. But from this perspective, all hospital staff, nurses, and doctors can perform chaplaincy duties, but each one can perform according to the knowledge that they have and the experience that they have, and more important, availability. Because they are required to be available to do other things, the chaplaincy role cannot be carried out fully by the doctors and nurses. So that's why we have got people appointed as Muslim chaplains, because chaplaincy duties require more time, maybe deeper knowledge, maybe higher skills, maybe more experience. So we need to appoint staff as full or part-time chaplains in a Sharia compliant hospital. I want to repeat that this does not refuse or reject or marginalize the chaplaincy duty of the doctors and the nurses. What does the chaplain do? He gives support by taking care of the patient's religious and spiritual needs, but also he should be involved in social and psychological needs. In some countries, the chaplain is called Murshidini, religious guide or counselor. He's a problem solver of ethical and fiqh dilemmas. A patient may have questions about how he can pray, how he can make wudu. You need somebody who can explain this to him. Also, the chaplain should be an advocate for patients' rights and welfare. The chaplain is in contact with patients. He or she understands their problems. So he should be or she should be the one to go to the hospital administration to bring these problems to them so that they can solve them. Now, a very important part of spiritual support is to enable the patients to perform acts of ibadah. You need to help them make their salah, their psalm as much as they can. We need to make dua for them. Also talking to them about Allah and the hereafter. This communication is very important for patients, especially in terminal illness, because death is coming and they feel this support at the last moment. Also, there are situations when patients receive bad news, when they are given a diagnosis of cancer. So the chaplain can be there to give them the support, emotional support needed to face the bad news. So I think chaplaincy must be recognized as an essential service in the hospital that is Sharia compliant. As I said, chaplaincy is a role for all people in the hospital, but we need some special people trained for this because the role of chaplain may require more time than the nurses and doctors can make available. So we need special training programs for chaplains. Before we choose chaplains, we need to realize that they can come from any background, could be social or medical. But the essential things that chaplains must have should be psychological aptitude, personality. And I think we may need to make some tests to make sure that the mental and emotional background of the prospective chaplain is suitable, because the hospital is a place of stress. You need somebody who can deal with the stress in a positive way. Now, chaplaincy training, again emphasizing our holistic approach, should be at 2 levels. There is a general short overview for all healthcare givers about what is chaplaincy and what is the role of chaplaincy and how do they carry out their work. But then we need a longer training for people who will be certified as chaplains, because those will be doing this job on a full-time basis. So what's the curriculum that we use to prepare? We start with Islamic sciences and then give them medical sciences. And also they need to know about hospital administration, really, because they must understand how things work in the hospital. Otherwise, they can be a nuisance. They need to understand the way the hospital works. Now, psychology, sociology, and anthropology are necessary social sciences for chaplains. This should be taught from a medical perspective. And then they need to be trained in the Islamic sciences, the basics of Aqidah, especially Qadr, predetermination. They need to be taught the Prophet's teachings on disease and its treatment, and also to understand the role of dua and ruqyah. We use Quranic verses and hadith in dealing with disease and its treatment, and we need to read and interpret them for the patient so that they understand, because Quran can talk directly to them. The chaplain also should know the fiqh of tahara and salah, because disabled patients want to make salah, but they don't know how to make salah because of their limited physical capacity. So the chaplain should know the alternative positions for salah for the handicapped. He should know the alternatives for wudu for the handicapped. And the chaplain also should be trained in how to deal with the bereavement when somebody has died, how to deal with the family in this period of bereavement, and also he should know how to prepare the dead for burial, because this preparation should start within the hospital. So the chaplain should know. And where possible, the chaplain can be part of the burial processes. Now, medically, the chaplain should know some medical sciences. He should know some basic medical terminology, types of diseases, types of diagnosis, and types of treatment modalities, and emergency and intensive care procedures, because these are the things that he deals with. He should be very familiar with them. He needs to know how the hospital is structured, the divisions, the authorities, and he should know the ward routines, and should know the functions of each grade of healthcare giver, so that he can know how to interact with them. So Alhamdulillah, as we conclude, Islam has concepts of life and health that can guide spiritual support for the patient. The ruh is the center of spiritual support, but around the ruh are psychological, emotional, and social aspects that we need to take care of, and the chaplain needs to take care of all of this. Unfortunately, we have done very little research on spiritual support from the Islamic perspective. We need more people to do research in these matters, publish papers, and publish books. Also, we need more people to write teaching material on these matters. And I think chaplaincy or spiritual support should be recognized as a separate professional grade. It's beyond religious guidance, Irshad Dini. It's more than just religious guidance. It's a comprehensive spiritual support for the patient that is multi dimensional. Thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh.